Good morning, everyone. I appreciate the chance to make this presentation today. I am Curie, a professor emeritus of nephrology from Seoul National University. I have nothing to disclose. I am the Secretary General of the Asian Society of Transplantation, and I am working with this listed organization in transplantation. This map displays rate of organ transplantation activity for Asian nations. As anticipated, Korea has the highest activity level. Nonetheless, Korea's organ transplantation activity rates of deceased organ transplantation falls within the lower to middle range of global rates. In Korea, more than 30 non-governmental organizations had been promoting deceased organ donation using a variety of donor cards to spread the message. As a consequence, more than 90% of the public had been informed about deceased organ donation, yet the majority of individuals opt out not to donate due to their lack of necessary knowledge needed to alter their perspectives. K-drama had also contributed to worsening this situation. In past, scriptwriters presented storylines in which the main character declared brain death would miraculously recover from what was in reality a vegetative state. This led to a widespread misconception among many Koreans that individuals declared brain death could still regain consciousness. The approach to establishing an organization with the goal of increasing public awareness can vary significantly depending on each country government system and culture. Spain has a centralized national program, whereas United States and Korea rely on coalition of non-government organizations, NGOs. Each of these options has its con and pros. A government-run organization can provide more reliable and efficiently organized program, but it might be seen as excessively formal or bureaucratic. On the other hand, a coalition structure can be self-driven and adaptable, but it may lack the same level of organizational structure and consistency. In 2009, the Korean Society of Transplantation took the lead in creating a non-governmental organization named VitalLink with the objectives of increasing public awareness on disease organ transplantation. The VitalLink's primary objective include creating educational resources tailored for specific target audience and delivering training programs for the staff working within other NGOs. Additionally, VitalLink established CODONET, the Korean Organ Donation Network, a coalition made up of other NGOs. There are numerous methods for boosting public awareness, such as utilizing donor cards, establishing memorial park, hosting transplant games, events during National Donation Week, utilizing both traditional and social media, and implementing educational programs. Initially, VitalLink and CODONET took on a wide range of tasks, including most of those previously mentioned. We have actively participated in government-led events during the second week of September, known as Korean National Donation Week. And we have been involved in various campaigns organized by CODA. Additionally, we have been actively engaged in international transplantation games. However, just approximately 4% of all adults in Korea possess a donor card, which serves as an indicator of public awareness. This means that public is still not very interested in organ donation and incooperative in having a donor card, which leads to rejection in the event of brain death in the family. In other words, in Korea, which uses an opt-in system, family consent is required for final authorization to procure organ from a deceased person. This decision can only be made if every family member holds a positive attitude founded on accurate knowledge and a clear understanding of the significance of deceased organ donation. The primary reasons for people refusing to register for a donor card, as revealed by the Population Attitude Survey conducted by the Center for Disease Control and Prevention, CDC, includes a hesitation due to vague reasons, lack of knowledge about the registration process, opposition from their surroundings, perceived complexity in the registration process. And the main reasons for their unwillingness to register can be summarized as first, concerns about body damage or mutilation; second, unsuspected fear or anxiety; third, insufficient information about organ donation; and four, lack of personal experiences or exposure to organ donation. Considering these findings, we realized that in order to change the public's attitude toward organ donation, it is necessary to systematically deliver accurate information to make them realize the importance of deceased organ donation through education. Hence, we have devised a comprehensive plan with 5 distinct steps for education: identifying target population, delivering educational materials, building team for implementation, progress evaluation, and future education program planning. Training targets prioritize the following groups as you expected: healthcare professional, donor families, students, and community leaders. CODA take responsibility for healthcare professionals and donor families, while VitalLink handles students and community leaders. The primary and most crucial focus for education should be on medical professionals. This is particularly important because while the incidence of brain death is just 1% in general population, it significantly rises to 10 to 15% within hospital settings and notably reaches 55% among patients receiving ventilatory care. And among patients in ventilatory care, the organ donation can be done in 20%. Conversely, the reported rate of potential deceased donor by healthcare professionals remained quite low due to concerns such as the risk of conflict with the family members of the possible donor. Furthermore, During our seminars with hospital executives, we were surprised to find that their understanding on brain death donation was quite inadequate. To solve this situation, we have introduced a mandatory reporting system, which is a coercive method, and all cases of potential brain death must be reported to CODA under the Organ Transplantation Act. In other words, the doctor who sees potential deceased donor should tell the family member that they must report it to CODA. Then the doctor contacts CODA, which send a special trained coordinator to meet the family members at the hospital. In addition to introducing mandatory reporting law, CODA conducts educational workshops and seminars and has implemented a donation improvement program DIP, which was inspired by donor action model from Belgium. This program has successfully increased the number of potential donors by identifying ways to enhance early report to CODA after reviewing medical records and evaluating hospital attitudes. The next most important target to educate is the donor family. Family refusal was the most common cause of donation failure in Korea. The CODA annual report also showed a family consent rate of 33%, which brings a huge drop in the consent rate. Once donor families understand the importance of organ donation, they are better able than anyone else to explain the difficulties of the process and the reward of donation to others. In Vietnam, we know that donor families have been instrumental in raising awareness of organ donation. Many countries have set up memorial park to honor donors and organize various commemorative events such as annual donor recognition ceremony. Deciding on organ donation when a family member is diagnosed as brain dead in a hospital is an exceedingly difficult situation. This occurrence often happens unexpectedly, leaving family members ill-prepared to make such a decision while the patient's heart is still beating. To address this issue of family refusing organ donation, we implemented several measures. First, we initiated the My Family Should Know About My Wish campaign. Second, we streamlined the family consent process. Third, we introduced legislation for forced person authorization. Fourth, we decided to promote the donation after cardiac death program. The My Family Should Know About My Wish campaign provides valuable training for both new and old existing organ donor cardholders, equipping them with effective communication skills. You can find instructional video on YouTube to assist you in discussing your organ donation intention with your family like this.
내가 얼마 전에 장기기증 사역을 했어.
The next most important target to educate is the students. We can use classroom time to better explain this complex issue to the students and convince them of importance of organ donation. And through school education, we can deliver accurate knowledge and meaning of disease organ donation not only to students but also to teachers and their families. Various education programs can be developed depending on the age of the students. In some places, they teach children using a role-play program, while others, they host activities for them. In Minnesota, education during using a video is mandatory before they get a driver's license. We created and shared a guidebook for education, as well as created an offline and online libraries on organ donation teaching aid. We used various methods, including the YouTube VitalLink Academy channel. A youth education manual was initially created and released by volunteer educators for middle and high school students. Following this, a successful pilot program for middle and high school education was introduced. This program was structured to enable both teachers and students to express their perspectives on disease organ donation through diverse techniques. It offered students a comfortable and enjoyable method to tackle the often uneasy topic of death and organ donation in Eastern culture. A positive feedback received from numerous students include statements like, "I'd like to engage in life sharing before I pass away, and I've realized that organ donation can potentially save many lives." The next program is an educational initiative for pre-medical and medical students in partnership with the VitalLink, students, and professors in medical education. It's a co-participatory educational program to enhance student participation. Further information about this program will be released shortly on Transplantation Direct. The education team produced a self-learning tool for students, and these resources were made available on YouTube for preview. We also made a survey tool to examine, to analyze students' knowledge, awareness, and attitude towards life sharing. The survey featured 31 questions prior to the training and 12 questions after the training to measure its effectiveness. Following that, we divided the students into groups of 5 to 6 and allocated each group one of the 3 topics for discussion and the presentation of their findings on a poster. The top posters were selected individually for each topic, and the students conducted an online presentation during the COVID-19 pandemic like this.
안녕하세요. 저는 장기기증 포스터.
After the pandemic has subsided, the presentation shifted back to being in person. After training, interest in organ and tissue donation increased significantly from very low level to 85%. Moreover, the overall attitude toward organ and tissue donation becomes significantly more favorable, reaching a rate of 98%. After the education program, a remarkable 96% of students expressed their strong willingness or a moderate willingness to donate their organs. And all the students expressed a willingness to recommend disease organ donation to their family and friend after the education. This clearly reflects a significant and positive shift in their attitude toward organ and tissue donation. The final target is to educate influential individuals in society and seek their assistance in promoting the culture of life sharing with us. In Korea, the life sharing movement benefits from the active involvement of religious leaders. Regular seminars were held to educate the National Assembly members who play a crucial role in our society. We had held life sharing events with members of Rotary International, while we also encouraged well-known K-drama actors and singers to join us. In Hong Kong, members of the Rotary Club have been dedicated to promoting life-sharing value. The Mongolian Rotary Club, a highly respected advocate, joined the life-sharing movement in 2017, and this may allow for campaign encouraging organ donation in Mongolia. And with the hard work of Mongolian organ transplantation team, made it possible to establish a successful and transparent disease donor organ transplantation program in Mongolia. Now Mongolia has become one of the Asian countries with high organ transplantation activity rates. In countries like Vietnam, where a significant Buddhist population exists, the involvement of Buddhist society can provide highly beneficial effect. In summary, it's essential to highlight the importance of these listed targets and design education program tailored to specific targets for increasing public awareness. Furthermore, it is crucial to adapt this program to align with the unique cultural and national governmental contexts in which they are being carried out. I'd like to express my gratitude to everyone who has been participated in VitalLink and to the organ donors and their families who have been contributed to organ donation to save lives over the past 14 years. And also thank you for your participation today. Thank you.